Stomach 20 is 2 cun lateral to the midline, 5 cun superior to the centre of the umbilicus at the level of Ren 13. Stomach 23 is 2 cun lateral to the midline and 2 cun superior to the centre of the umbilicus at the level of Ren. Gallbladder 24 is 4 cun lateral to the midline in the 7th intercostal space. When you palpate this point, make sure that you are in the intercostal space, not on the rib. Ren 13 is 5 cun superior to the centre of the umbilicus on the midline. Ren 8 is in the centre of the umbilicus. Pericardium 7 is on the flexor aspect of the wrist. It's level with heart 7 and between 2 tendons, palmaris longus and flexor carpi radialis. Some people don't have this palmaris longus tendon, in which case you'd just be going ulnar to this flexor carpi radialis. So finding heart 7, articulate the wrist, coming between those 2 tendons, that if you can't see them, you can get the person to join their thumb and their little finger together, and that will highlight those 2 tendons. And just relax again. Pericardium 2 is 2 cun inferior to the anterior axillary crease, in between the 2 heads of biceps brachii. If you pinch the muscle up either side and put your finger in between the 2 heads, that will be where pericardium 2 is.
Stomach 41 is located on the anterior aspect of the ankle flexure. It's on a level with the prominence of the lateral malleolus. It is located in between the tendons of extensor hallucis longus and extensor digitorum longus. To reveal extensor hallucis longus, get the person to pull their toe up against resistance. Locate this point in a nice dip just lateral to that, actually in the ankle joint. Articulate the ankle to make sure you are actually in that joint. Stomach 45 is the lateral nail point of the second toe. Be sure to mark this point clear of the nail bed and in the flare of the base of the distal phalange. Stomach 42 is located on the dorsum of the foot between the second and third metatarsals and the cuneiform bones. It's approximately 1.5 cun proximal to stomach 43. In some people, when they point their foot and pull up their toes, a nice depression appears here. Spleen 5 is located in a depression which is anterior and inferior to the medial malleolus. Trace along the anterior border of the malleolus and the inferior border and then palpate whilst you articulate the foot. Feel for a nice dip. Spleen 5 is in that dip. Spleen 7 is located 6 cm superior to the prominence of the medial malleolus, half a finger breadth posterior to the medial crest of the tibia. If you're having difficulty identifying the medial crest of the tibia, just raise the leg slightly and the flesh will fall away from the bone. Remember, it's half of your patient's finger breadth, not your own. Kidney 7 is located 2 cm directly superior to kidney 3. Locate your kidney 3, move up by 2 cm and mark this point directly on the anterior border of the tendocalcaneus.
Kidney 10 is at the medial end of the popliteal crease, in between the two tendons of semitendinosus and semimembranosus. Locate this with the knee slightly flexed. Kidney 10 can also be found in the prone position. To bring the two tendons of semitendinosus and semimembranosus into relief, you can ask the person to push up against your hand against resistance. This will bring the two tendons into relief and you can palpate in between them easily.
Liver 1 is the lateral nail point of the big toe. Be careful not to confuse it with spleen 1, that's the medial nail point of the big toe. Liver 1 is the lateral nail point of the big toe.